Let's discuss the gut nutrient thyroid excess. To start, this is Laura, and I discovered a concept in the clinic with Laura. This is going back probably about 7 years, and if you could bring the mic down just a little bit more. Can you bring the mic down just a little bit more? I'm a little hot. Laura came in having been diagnosed with hypothyroidism by her endocrinologist. She was treated, she was on hormone, her blood hormone levels were normal, but she was still having symptoms: fatigue, insomnia, joint pain, and weight gain. And so we did some work to improve the health of her gut. I'm just going to bring this down a little bit. And by improving the health of her gut, a few things happened. She lost some weight, she was sleeping better, she had less joint pain. But the thing that was really interesting about Laura's case was at the same time as her endocrinologist was monitoring her thyroid levels, he said, geez, you don't need as much hormone. And he ended up cutting her dose in half. So just from improving the health of her gut, she was able to drop her dose in half while simultaneously improving her weight, her joint pain, her insomnia, and also her fatigue. So this got me thinking and paying more attention to this connection between the gut health and what's going on with the thyroid and just thyroid-related symptoms more generally. And so over time, and as the clinic expanded, it was myself and a few other doctors, we started seeing more cases like this. So often so to where we published 2 papers. The first in Integrative Medicine, a clinician's journal. It was a 6-part case series where we were just seeing this so commonly. We just drew up 6 cases that all fit the same sort of profile. And then we built upon that in affiliation with Christy Adamo in this next paper, who is with Maryland Medical, about how there's a nutrient malabsorption component that's tied in along with this, and that was published in the journal Nutrients. So there's a few concepts here to sort of cover and to develop a little bit. One is that you can improve thyroid hormone medication absorption by improving the health of your gut. And especially for someone who might be saying, gosh, I never feel like I get the right dose. I'm always sort of chasing my TSH or my T4. This can be what's happening. Your gut health and your absorption is going through these oscillations, which, by the way, IBS, we know IBS tends to go up and down, right? And so it would follow that absorption would also kind of go up and down like this. Because 70% of your immune system is located in your gut, and the immune system uses inflammation as part of its response process, you can resolve many inflammatory symptoms also by improving the health of your gut. So this is a chronic brain fog, insomnia, joint pain, skin eruptions, can all come back to the health of one's gut. And of course, this can have an impact on not just thyroid autoimmunity, but autoimmunity sort of categorically. And then there's the key nutrients. Selenium and myo-inositol and vitamin D are important for thyroid autoimmunity, and there's also pretty compelling data showing that these nutrients can stabilize TSH, especially if you're someone whose TSH is just creeping up a little bit, 5, 6, 7. It's been pretty impressively documented that vitamin D, selenium, and myo-inositol can help bring you back down from what's known as subclinical hypothyroid back down into normal. Iodine is interesting in the sense that one study looking at people who are on long-term paleo dieting, long-term being defined as a year or longer, showed an increased risk of iodine insufficiency. And part of this may be due to dairy and bread products being fortified with iodine, and also that sea salt is not a great source of iodine when compared to iodized salt. So what might be happening in these cohorts is public health figured out people aren't getting enough iodine, we're going to add it back to the food supply through these foods, and then paleo dieters are avoiding those foods. So it can be circumvented. You could easily plug in what you eat into, let's say, Chronometer or MyFitnessPal for a week, and then just run a report to see if you're under-eating the RDAs for dietary iodine intake. But it's really the iron and the B12 that has the highest incidence of malabsorption. And this is because up to 50% of people with hypothyroidism will also have insufficient secretion of stomach acid. And you need that to ionize the minerals. Now, I say up to with that little bit of a caveat in my voice because I'm not claiming that half of people with hypothyroidism need supplemental HCl, but it can go as that high in some of the studies. So coming back to Laura, what would happen if Laura never improved her gut health? It's pretty likely she could try all sorts of different thyroid medications, right? Let's say she's on Synthroid. Now she says, well, I need T3, so I'm going to add Cytomel. Or I'm going to go to a desiccated. I'm going to go to Armour or Nature-Throid. All the while missing the fact that her symptoms and her medication really was just being malabsorbed. You follow? Right? This happens more often than you would think. And in fact, this is one of the studies, one of the cases in our case series from Dr. Joe Mather. Boy, Joe was just trying everything with this patient. Higher dose Levo, Levo plus Cytomel, switched over to Armour, from Armour to Tyrosine, from Tyrosine back to Levo, and could just never help this person. Until he used high-dose probiotics and antimicrobials, both gut-directed therapies. Then within a month, and we have a chart of her TSH in this case series, just goes right back to normal and stabilizes. So that's one important point for Laura. The other that I'm more excited about is, what if someone with symptoms similar to Laura was just given thyroid hormone because her doctor didn't know what else to do? Right? You're complaining about symptoms. You're not really hypothyroid, but I hear you, right? I'm a doctor. I care about helping people. Maybe this could help. That leads to this number right here. This is a very important number. A recent meta-analysis of 17 clinical trials summarizing over 1,100 patients' experience found that 37.2% could stop their thyroid hormone, maintain normal levels of thyroid hormone all on their own, so their thyroid glands worked, and they had no change in their symptoms. So 1 in 3 may be on thyroid hormone that they do not need. The travesty about this is people don't think about double-checking the diagnosis, right? You go from one doctor to another. What are your medications? What are your diagnoses? You list them off. No one thinks to say, are you truly hypothyroid? I can say we find a case of this per week, right? It makes sense. If it's 1 in 3, we would see it fairly commonly. So this is the other thing that I think is most endemic in this cohort, right? The people who are seeking out the integrative practitioners who are going to be even more prone to say, well, let's try thyroid hormone. And then 2, 3, 4, 5 years later, you're still on that thyroid hormone because no one ever said, hey, can you send me the labs from the time of diagnosis to double check? This is why I think this podcast, sorry for the granularity on the image, has over 100,000 views already. It's only a few months old. This is Dr. Antonio Bianco, wonderful gentleman, endocrinologist, former president of the American Thyroid Association, and he's seeing this same exact thing in his practice. And he was sort of reminiscing, if you will, about how, as an endocrinologist, he's in a tough spot because when someone's suffering with symptoms and they think it's thyroid and he doesn't give them thyroid hormone, they get mad. Why won't you listen to me? I think it's a thyroid. I read the thyroid blog and all my symptoms point to thyroid. And Bianca will say, well, you don't fit the criteria for the diagnosis. So this is a big problem. There's solutions, and if you're suffering, there's things we can do about it. So we have to kind of disentangle, if you're suffering and we're saying it's not your thyroid, it doesn't mean there's not a cause. We just want to be discerning about treating the actual causative factor. So we do want to rule out overt hypothyroidism, and this is where, if you look at the labs from before you started hormone, that is key, because once you're on hormone, you can't assess what your gland is producing because you're taking the hormone exogenously. So TSH between 0.45 and 4.5, and a free T4 between 0.8 and 1.8. These are the normal ranges. Now, one of the things that's tricky, and I think pernicious, is someone might have normal free T4, but they have a TSH of 6. And so their doctor says, well, this is subclinical hypothyroid. That's the name, also known as sort of sluggish thyroid. Let's give you the hormone and see if it helps, all right? And this is how we come back to that 37.2% of people. But here's the other thing. Let me take a step back. In healthcare and medicine, we have varying levels of study on different conditions, right? I would say mold, Lyme, understudied. There's not a lot of great research in these areas. But for sluggish thyroid, there have been numerous clinical trials where researchers said, let's see, let's test this. Let's give people who have subclinical or sluggish thyroid either a sugar pill or the hormone. We're going to blind the researchers, we're going to blind the patients so nobody knows who's getting what, and then we're going to reappraise their symptoms. And very consistently, it's been documented that people with sluggish thyroid don't symptomatically improve when we give them thyroid hormone. But wait a second, I've heard someone say that they did. This is placebo, right? If you tell someone you're going to benefit from this, or better yet still, if they've read about how thyroid hormone can help XYZ, then you give them the pill and you ask them a month later, how do you feel? It's very probable they're going to say, I feel better, right? But that's a transient placebo effect. Okay. The parallel track here is hypothyroid or not, it's important to improve your gut health, because the gut health may help with the thyroid hormone absorption, but it may also resolve the symptoms, whether they're thyroid symptoms or not, like Laura, right? Her weight gain, her fatigue, her insomnia, and her joint pain all improved from a gut-based intervention. One of the things I've been realizing just over maybe the past 6 months or so is the diet for improving gut health tends to bifurcate into one of two directions. A bacterial type, think SIBO, small intestinal bacterial overgrowth, IBS, or a fungal type, think Candida. And the diets therein are kind of opposite, right? IBS patients, if they've done a SIBO breath test where you eat just rice and meat in preparation for the test, go, Doc, I felt great on the rice and meat diet. You give a lot of rice, white rice, to a fungal individual, they're going to flare, right? So it tends to bifurcate this way, and it really helps reconcile why some people can't quite figure out how to eat for their gut. It's not an absolute heuristic, but it's going to get you pretty far in terms of bacterial versus fungal types. And regarding Candida, it is normal in the gastrointestinal tract, but it's also an opportunist. So if you're under stress, if you're not sleeping well, if you're drinking too much, if you're eating a high processed food diet, what have you, now the Candida starts to overgrow, and they create these filaments called hyphae that burrow down into tissue and anchor them, making them more resistant to treatment, but also triggering an inflammatory response. And so this is why we can see fatigue and mood issues that are associated to a problem in the gut, as well as gastrointestinal symptoms, most notably bloating and looser bowels. Candida doesn't tend to cause constipation, although it can, but the general trend is going to be a looser bowel presentation. Carb cravings. And sometimes these are insidious. I just like some chocolate after dinner, right? I just don't feel satisfied unless I have, and I'll speak for myself here, right? This has happened to me. I just don't feel satisfied unless I have like a banana or whatever it is. So that can be a tell. It can also mean that you're just hungry, right? But you want to be factoring out some of the obvious. I've eaten enough, but I don't feel satisfied until I have something sugary or starchy. That can be a clue for candida. Thrush, a white tongue, rashing in the armpit fold or in the groin, or vaginal yeast. These are all things that indicate, toenail fungus would be another one, that you could be at risk of being this sort of fungal type or at risk of a fungal overgrowth. And risk factors, antibiotics, one time, probably not a big deal, right? But if you are on, let's say, amoxicillin in high school for your acne, prolonged, right? Or if there have been multiple, let's say, sinus infections or ear infections, and you've had multiple courses, now you're sort of growing the risk. Contraceptives. And this is because estrogen, while it's immunostimulatory throughout the majority of the body, which is why women have, generally speaking, more autoimmune conditions than men, it also suppresses immune function in the vaginal cavity. Can you guess why? Fertility, right? You don't want to have a super revved up immune system because you don't want to be attacking sperm. So this is why 75% of women in their reproductive years will have at least one bout of vaginal candida. But if there's too much estrogen, that can be problematic. The Western diet, obviously it's going to be high carb, low fiber, stress, older age, and we'll come to the diet here, but essentially a candida diet. Now, one caveat I would issue about the candida diet is, like anything else, you go and you read some candida diets out there are just like, whoa, pull it back a little bit. No caffeine, no carbs at all. It's like a definitionally keto diet. And the travesty about that is some people are going to sleep poorly. They're going to have marked insomnia. They're going to have thinning hair, maybe amenorrhea for women. So it needs to be a controlled carbohydrate diet, if you will. Brown rice would be okay. Potatoes would be okay, within reason. Potato chips, no. White rice, no. Bananas, probably not. Berries, okay. Right? So you can have carbs. You just want to be a little more selective. And this is sort of just a listing of how some of these foods divide into sort of allowable versus not. I also want to make a quick note about caffeine, because you see some people saying on the candida diet you can't have caffeine. And we fact-checked this. There's no really rigorous studies looking at this, but there are 2 studies that have found caffeine has antifungal properties to it. So I don't think you have to avoid caffeine on, But also consider this. You read some of the logic, and it's this super long chain of inference. Caffeine stimulates the adrenals. The adrenals make cortisol. Cortisol is bad for your immune system. Immune system is needed for fun. It's like, whoa, dude, you need to shorten that chain of inference, right? Because with that logic, you could make a note that anything is bad for you. Okay. And regarding testing, without going too far afield, I thought this study was fascinating. It's just one person, so caveats here apply. But the researchers had this person brush their teeth once per day for 2 days, then after every meal for 2 days, and go back and forth. And what they found was a 10 to 100-fold variance in candida in the stool, depending on how you brushed your teeth. The more often you brush, the less candida in the stool. Now, I'm not claiming that you need to go out and brush your teeth fervently, right? But it just makes the point that how we say or how we quantify normal versus abnormal levels of candida in the stool isn't quite so obvious. What we're doing in the clinic is pairing a stool assessment along with a urinary diarabinitol and a candida antibody. And I'm not convinced about this, but we're going to correlate that with the candida questionnaire, a symptom inventory, and see if these correlate over time. What I care most about is, do the candida symptoms go down? Do you have less thrush, less vaginal yeast, less cravings, less diarrhea, less bloating? And if we can show a correlation between that and these lab markers, then we might just forego the lab markers because we've qualified that the labs and the questionnaire correlates. But in any case, with stool testing, you have to be careful. And the reason I issue that caution is, I remember this, I can't remember her name off the top of my head, but I remember sitting in the clinic with her, and she was saying, I just feel so much better when I eat carbs. Like, I have better energy, I sleep better. Begs the obvious question, well, why aren't you eating carbs? Well, 3 years ago, I had candida on a stool test. Well, let me get this straight. You feel good when you eat carbs? Oh, yeah, like my bowels are better, my energy's better. Then eat carbs, right? But what can happen is people can end up looking at a lab value like it's gospel. And some labs are accurate, right? Fasting glucose, pretty accurate. The thyroid labs, despite what many will say, I would argue are pretty accurate. Stool testing is not super accurate, so that needs to be more of a take with a grain of salt, not target all of our treatment recommendations around that lab marker. Okay, so coming to the bacterial type, there's definitely some similarities. Abdominal pain, bloating and gas. This is where diarrhea or constipation comes up. There can be fatigue, and there can be mood issues. The risk factor here that's probably the most different is a bout of what's known as traveler's diarrhea or acute gastroenteritis. This can lead to what's known as post-infectious IBS. You guys may have heard of this, right? So it's a little harder, in my opinion, to read the history to dictate the bacterial type other than post-infectious IBS. But the diet here would be a low FODMAP diet. And this is where I suspect this crowd may have the most to gain, because I'm assuming a lot of people here are doing kind of like your lower carb paleo type diet, which is all fine and good. To me, I don't care, because as a clinician, you see enough people who don't do well on the thing that you were excited about, and you're humbled. And early in my career, I was like, all paleo, paleo's gonna save the world. And then enough people just smacked me in the face with the reality that they didn't do well on paleo, and I had to keep digging. So although FODMAP diet is gonna reduce foods rich in prebiotics that feed the bacteria. Now, these aren't bad foods. Asparagus, broccoli, cauliflower, garlic, onions, these have a lot of health benefit to them, but if you're currently in the situation of bacterial overgrowth, reducing these foods can help balance the ecosystem. And something else I should mention is most of these diets, if they're done correctly, tend to be curative, reparative. They rebalance you, and food tolerance then improves. So that's a really important concept, because dietary neuroticism is so easy to sort of slip into, and it's, I feel, crucially important to just say it out of the gate, this is a rehab diet. Like if someone hurt their back, they wouldn't say, well, I'm not gonna exercise and I'm always gonna be wearing the heat pad and the brace forever. They would logically know, okay, I'll do rehab for a while, I'll do my foam rolling, I'll do my PT, I'll do whatever it is, and then I'll gradually resume activity. And yeah, if I push too hard too soon, I might have a flare. If you reintroduce too much too early, you might have a flare. But the trend should be one of recovery of function or recovery of dietary tolerance. You may notice that you always skew a certain way. Like, I can never go super high carb, but you should be a big step forward in terms of tolerance from where you started. Okay, supplemental approaches. I have become a progressively big fan of probiotics as we've been just following the research published on this. And case in point, as one example, probiotics are both antifungal and antibacterial, as well as being anti-leaky gut, anti-inflammatory, and pro-motility. So that's a simple intervention that can hit both camps, so to speak. If you're fungal or bacterial, probiotics can help either. Will they be a cure-all? No, but it's a great, simple place to start. Another reason that I like probiotics is this sort of gut-brain adrenal connection. This is involved. This is a paper by Dr. Alex Ford, who's over at University of Leeds. He was on the podcast about 2 months ago. We had a great conversation. This is one of the many papers he's published where they found that probiotics reduced the activation of the limbic system, specifically within the limbic system, the hippocampus. Now, why that's relevant is the hippocampus and limbic system in general regulates fear and also memory. So if someone has food fear or environmental fear or just anxiety in general, that can be an overactive limbic system. And again, they documented through functional MRI brain scans that they normalized the activity of this center in the brain with probiotics. Now that holds hands with another finding by Quigley and colleagues. And what they found was probiotics corrected what's known as a cortisol awakening response. So people who are tired tend not to have a robust secretion of cortisol in the morning. If you do have good cortisol output, you're up, you're bright-eyed, you're ready to go. But if you don't have adequate stress hormone, you can be dragging. And that's what they're showing here, right? At baseline, people had abnormally low levels of cortisol secretion, but they normalized week 4, week 8 on the probiotic, and then they stopped, and their scores started to revert back to normal. So it was probably insufficient length of the intervention, but nevertheless, they showed this connection. So if Ford shows that the gut intervention of probiotics rectifies the limbic system, remember that part of the limbic system is the hypothalamus. And the hypothalamus controls all the secretions for adrenal and thyroid output. Right? That's your master regulator of the hormone system, is the hypothalamus. And so it would make sense if the hypothalamus is working better, its secretions to the adrenals also improves. Right? So this is a gut, brain, adrenal connection. So said simply, you can correct your cortisol levels if the probiotic intervention is successful. The key note here about Quigley's study is the people who had this response were the people that saw improvements simultaneously in their digestive symptoms. And this is the evidence-based meta-protocol we've been developing now for about 2 years. We're currently working on a scientific paper to help give doctors some guidelines for probiotic recommendations that are like over-the-counter. Probiotics tend to break into one of 3 categories: your traditional blends of lactobacillus and bifidobacterium, or a healthy fungus, Saccharomyces. There's Boulardii, there's Cerevisiae, or a soil-based probiotic. These are Bacillus species. Any one of these is viable, in my opinion. You see the dosages here, and you should notice within 2 or 3 weeks if the intervention is successful. But some studies are finding that there's not full response until the 2nd or 3rd month, most namely with constipation or with metabolic and inflammatory conditions. So I do think you should notice something within the first few weeks, but you may not hit full response until the 2nd or 3rd month in. There's also herbal therapies. I love herbal medicine. Case in point number 1, this first study in garlic, they administered 500 milligrams 3 times per day and found this was as effective as fluconazole, the drug, for vaginal yeast infections. Amazing. And this is data that we currently have in peer review for publication, where we gave 2 different types of herbal therapies for SIBO, and we found essentially the same clearance rate, about 40% in either group. And this is a blend of oregano, black walnut, caprylic acid, berberine, your standard blends. I don't think there's one special proprietary blend. There's a dozen or so herbs that are all pretty effective here that can be used in combination. So in summary, a healthy gut does seem to lead to a healthy thyroid. It's not the only factor, but it's a really important one. Reminder to check your iron and B12 if you have symptoms. Iron is a little bit more straightforward. It's ferritin. B12, it's not quite so clear-cut. So if you're suspicious of low B12, if you notice tingling, if you're someone who, if you sit in the wrong position and you get numbness, or if you have insomnia or fatigue, then you may just want to try a B12 supplement for a month and see how you do. I'm more in favor of just trying the experiment than saying, well, it's got to be low serum B12 or a low urinary MMA, because they're not perfectly accurate with capturing the need for vitamin B12, at least in my opinion. Double check your thyroid diagnosis. Check the labs from before you went on thyroid hormone. If you don't see a clearly high TSH paired with a low T4, then you weren't hypothyroid. Always check this with a healthcare provider. Right? I want to be careful that people don't go too rogue. But if your TSH was 5, 6, 7, 8, it's very likely that you're subclinical hypothyroid. And like we discussed before, those people don't benefit symptomatically from hormone. And by the way, over half of those cases will spontaneously go back to normal all on their own. If you add vitamin D, 83 micrograms of selenium, and 600 milligrams of myo-inositol, that can improve the likelihood that your TSH will go back to normal. Determine your gut type and eat accordingly. And consider trialing a probiotic. And then if that's not totally sufficient, don't stop, but layer on top of that an antimicrobial of some sort. And this phasing is important because one of the things that we will see is people will come in frustrated having had tried all of the things, but they did them one at a time and they weren't sort of building a plan. So think about it like you're walking up this staircase. I gained 20% from the diet. I gained 30% from the probiotics. I gained 20% from the antimicrobials, right? Then get to close to full resolution and hold. And then you can start broadening the diet and reducing the supplements. And I like this quote from Darwin: ignorance more frequently begets confidence than does knowledge. And as an adjunct professor, as a clinical researcher, I get frustrated by what I see online. It's always the strong opinion that seems to get the most press. And the clinician in me winces because it's always like, well, that might be true, but then it may not be true, right? But that's not as sexy for like a 60-second reel on Instagram or whatever. So I found this to be very true, is that the more confident someone's statements are, usually the less informed they tend to be. And that can be a safeguard in terms of you're going to go out and listen to podcasts and read blogs. Pay attention to that nuance in terms of how are they saying what they're saying. And that can help you, I think, circumvent getting bad advice. And that's it. I'd love to take any questions, and hopefully this is helpful. Thank you.
Yes, is there a home test for gastric acid?
Is there a home test for gastric acid? There are. I don't know how accurate they are. There's a pill you can swallow on a string, and I think the best way to assess that is to trial HCl, but I would do that end phase. After diet, after probiotics, after antimicrobials, try to clear out some of the symptomatic noise, and then it's much easier to assess, I'm now going to try HCl, and either symptoms improve within 1 or 2 weeks, or they don't. And when people need it, it's pretty obvious.
I noticed for the bacterial, you didn't have any proteins. You just had the fruit and stuff.
Yeah, proteins tend to be fairly well tolerated. So I haven't found, unless it's like processed meat, where you have emulsifiers, which irritate the gut lining, and added sugar, proteins tend to be okay on either side, at least as far as I've been able to tell. Yeah, I don't think proteins, unless they're processed. Any processed proteins, I mean, the more processed, the worse it is, right? And there are nuances there where there's another gut type I didn't include, which I call the immune histamine type. For people who are histamine sensitive, canned tunas and jerkies, because of their histamine content, can be a problem. But that's, there's only so much I can cover in this.
Do you consider quality of processed foods at
Yeah, I look at it as like a gradient, and really, and I should say it this way, it's the ultra-processed foods that are the most deleterious. But you will see some jerkies, on that note, some jerkies have as much added sugar as they do protein. It's like, it blows my mind.
I know you can't recommend that I get off my levothyroid, but I'd like to get it off. Are there any recommendations? I'd like to get off it. Are there any recommendations you would have, like the first few steps?
Yeah, I mean, you can listen to the interview with Bianco. We have a thyroid self-help course that recommends lab work, and it gives you a calculator, but that's not going to help you if you're on the hormone. So you'll want to use the criteria we discussed in the course or in the Bianco interview. Bianco also has a book, and if you can find the labs before you started the hormone, those are going to be really revealing. And then wean-off protocols, there's been generally 3 that have been used: cold turkey, and the other 2 are either halving or essentially quartering over time. I don't think it makes a huge difference one way or the other.
I have a question if you have any experience with like a candida cleanse. I just have a hunch that this is what happened to me, but I'm just curious if you have any further information on it. About 5 years ago, I did like a candida cleanse that you would find like in the grocery store, not thinking too much about it.
Right.
And I started it, and after like a week or 2, I started to get small pustules on my face. And then I stopped taking the supplement thinking that would help, and I went through months of an extreme bout of like the most painful cystic acne, and nothing I would be able to do would get rid of it until I figured out some other stuff. Sorry, I won't get into it, but I'm just curious if you know anything or have any experience with like extreme candida die-off correlated to cystic acne.
I can't say with acne specifically. I do, although I will say that candida does tend to be more prone to cause die-off.
Okay.
Not so much so with bacterial overgrowth. And this is important because someone may notice joint pain for 2-3 days or headaches for 2-3 days. And it's important to delineate. If it's severe, then I would back off. But sometimes people will say, "Ooh, I'm getting joint pain," or "loose bowels, I'm going to stop." And usually a die-off stops within a week. So it's just important to note that, though, because things may get a little bit worse before they get better.
It might have been like a coincidence, so I've always just had a hunch because the 2 coincided. But
Yeah, you may have triggered something, or it may have been that, like you said, that was a sort of a parallel track, and the acne was just, something was waiting to trigger that, and it just happened to overlap.
Something about xenotestosterone, I don't know, and then I started going down this whole path, and I was just trying to figure it out. I really appreciate your talk. Thank you.
Yeah, of course.
Do you have any hunches to why some people are really reactive to probiotics?
This is why we use that category system. Some people, in my experience, it's not many, I would estimate it's less than 10% have a true negative reaction. Some might have a transient adjustment reaction. So we have to like clarify, is this a frank intolerance as compared to a die-off, firstly, but then beyond that, that's why we have those parsed by the categories, and sometimes you will see someone that just can't do a soil-based, or they can't do a lactobacillus. What's helpful about this is people don't make that connection, they don't read the labels, they just look at, well, you know, there's this one called Flora Restore, and this other one called, you know, Gut Heal, and they may have tried 3 times the same type of probiotic, and they keep having negative reactions. So that's one of the things that we dig into in the history, and you'll often see, oh, you've tried the same type every time, so let's try Saccharomyces with you or something else. So hopefully that helps.
Yeah, I mean, like stuff. I tried like several different times, and like even did all the research, like the non-histamine forming ones and the soil-based, and it just seemed to be like this trigger. So is that an indication that it is a die-off, and it should just be like?
You've had reactions to all 3 types? Yeah.
Even just like a little tiny bits.
Yeah. Then you may, well, I mean, there's more. I don't want to dominate too much, but this may happen in histamine intolerant individuals. Their immune systems are really wound up. And in some of those cases, we start with antihistamines, even including over-the-counter antihistamines. This is something that, a big credit to Tanya Dempsey, she's got me thinking more about Benadryl, Claritin, loratadine, famotidine, for some people, can be super helpful. And they'll even, when you ask them, they'll say, yeah, Claritin really helps, but I don't want to take it too often. And for some of those people, we just need to calm down the immune system for a little while so they can tolerate other therapies that are reparative, and then they can come off of those.
I have a two-part question. One is, how important is T3 test on getting hormones, thyroid hormones? My friend of mine has been on thyroid all her life, so that's the most important one.
Yeah, you hear that. I tend not to agree with that. But there's one important thing to parse here, which is a little less than maybe 50% of people will feel better on a medication that contains both. But I don't know that we need to be routinely testing for the T3. You can start someone on T4, and I know that's sort of counter-narrative, but my perspective is we want to give the body the ability to metabolize it as it sees fit, because some people react negatively to T3. And this is another thing that we see. They come in with insomnia and anxiety.
I just was wondering if I should go ahead and get it tested or not.
No, I don't. My opinion is that you don't need to test it. But if you're on T4, let's say leave. Okay. Yeah, so if you're talking about general screening, early phase screening, then no. Because T3 is usually dysfunctional, if you will, secondary to something else. It's not telling you about the viability of the gland to make hormone.
The other question, separate from that, was I self-diagnosed with Gilbert syndrome, which is the high bilirubin all the time, but not real high, because my son got it, so I knew it was passed down from the mother. But I know it was jaundice as a kid. But anyway, and that I read somewhere recently that can people with Gilbert's can have low B12 all the time. And I was wondering what B12 takes to supplement, the methylcobalamin or the cyanocobalamin?
For that condition, I'm not sure. I haven't found that the different forms make a huge difference. I'd be open to either.
I take little bits of both, so
Okay, can't hurt.
thank you.
You're welcome.
So as far as like, you're talking about hypothyroidism and stuff like that, what is the potential of, like you were saying, getting off levothyroxine as someone with Hashimoto's? I mean, is correcting
With
your
just
gut-
Hashimoto's?
Yeah, I mean, is correcting your gut health and things like that, will that ultimately lead up to?
Yeah, this is a great question. The prevalence of Hashimoto's as diagnosed by TPO antibodies is 20% of the population. The prevalence of hypothyroidism is 5%. The thyroid gurus don't tend to want to just share that 75% of people with Hashimoto's will not become hypothyroid. Also, and it's not to take anything away from those who are hypothyroid, but the risk discussion has been so botched, in my opinion. And so Hashimoto's can turn into hypothyroid, but I don't think if you're Hashimoto's, you should be on medication. There are studies that have shown that thyroid medication can lower the antibodies, but there's so many other things that also lower antibodies that it just seems illogical to me to put someone on thyroid hormone for managing their TPO antibodies.
Because I've dropped mine cold turkey before, actually currently.
The hormone?
Yeah, without being on Levo. And I didn't, I mean, for a little while I noticed a difference, kind of briefly, but outside of, like, when I stopped doing it, I don't really notice anything
You're that 1 in 3.
out of the ordinary.
Yep.
So I didn't know if that was, if correcting gut health and things like that would help continue that potential of not having to take that, because I typically try to
Yeah.
stay away from that.
There's not as much study here on the gut health connection over to the antibodies. There was one Polish study that did find a slightly higher level of TPO antibodies in those with SIBO. And there was another Italian study that found treatment of H. pylori lowered TPO antibodies. That was not replicated by another group that followed up. So the read on the direct relationship between gut health interventions being able to lower antibodies, I think, is still murky. But for other reasons, obviously, I think it's worthwhile.
I got kind of lost when you said determine your gut type.
So that's the bacterial type versus the fungal type. And if you had some of those risk factors from the fungal slide, that would indicate you're a fungal type. And if not, you might be a bacterial type.
So then, and then just follow like the diet that you recommend?
Yeah, a simple way you could experiment with this is you could do a 2-week trial on the Candida diet versus then on a low FODMAP diet and see which one you feel better on. And that would indirectly tell you low FODMAP indicates bacterial and Candida indicates fungus.
So because I was asking because my sister-in-law, she's been having H. pylori for years. She's in Morocco. She's tried different cities, different doctors, different medications, and nothing. I mean, she's just losing a lot of weight and a lot of pain. So I'm trying to, that's why I came here. I'm trying to ask doctor like what could be, you know, something that she can try maybe different to see if it's gonna help, you know, try to cure that H. pylori.
Yeah, I mean, there's a lot that can be done outside of antibiotics, for sure. So probiotics alone is a 20-ish% clearance rate of H. pylori. And other studies have found that when probiotics are paired with antibiotics, the clearance rate of the infection, not for H. pylori necessarily, but for different infections, goes up significantly when you pair the two. So she probably needs more of a comprehensive approach. If she's getting just like antibiotic after antibiotic.
Right.
Yeah.
They do like the 14 days in different kinds and it's just
Yeah,
more like
which can work for some people, but then other people, they need kind of, remember that staircase I was describing? She might need something like that that's a little bit more layered. We do virtual consults, so if she's in need of help, you can, we'd be happy to help her. Yeah.
I'm one of those rare people, but not the only one at this conference, where I had Hashimoto's, is that what you say?
Yep.
And they went in and did surgery, thought it was cancer, so they went in and I have no thyroid anymore. So do I follow the same?
Well, if you have no thyroid, then you're going to need thyroid hormone. But in parallel to that, absorption could be an issue, right? And some symptoms that you may think are coming from the thyroid could be coming from inflammation secondary to the gut. So it's worth a trial. Yeah.
Do you recommend nystatin or anything like that to fill out Candida?
Yeah, nystatin, fluconazole, open to either one of those. There's a whole bunch of herbs that work really well too. Yeah. Yep.
What about prebiotics?
Prebiotics, better for the fungal types. There's a lot of hubbub about prebiotics, and I sort of have been watching and waiting. There was a really pivotal meta-analysis published just last year looking at IBS, so this is going to be more of the bacterial types. No clinical benefit on IBS with prebiotics. Now, maybe part of that's because they didn't use the right prebiotic, but nevertheless, it's a meta-analysis of numerous clinical trials showing no symptomatic benefit. My thinking, and this is speculative, there's no data that I know of to support this, is that in a fungal overgrowth situation, that's where feeding the bacteria is going to be more important because you want them to police out the fungal population.
Fungal diet, you mentioned like potatoes and brown rice would be okay. Do you recommend like cooling and reheating for resistant starch? Or do you
Maybe. I mean, that would fall kind of underneath the prebiotic piece. And I'm still trying to clinically get a read on this, but my suspicion is that those individuals, the fungal types, will probably do well, generally speaking, with fiber supplementation like psyllium, prebiotics, including resistant starch.
How about those of us that have been on thyroid medication for like 15, 20 years, and so we don't have what our result, what the tests were before? Is there any way to?
Yes. Do this with your doctor, but discontinue the hormone and then reassess TSH and free T4 6 to 8 weeks later.
Okay, well, they do that now, but how do I know if it's the correct diagnosis or not? Because I don't feel like I'm getting any better.
We'll use some of the criteria that we outlined.
But I thought that was only before you were on thyroid meds.
So what I'm saying is you can stop the medication
Oh, stop that.
and then retest 6 or 8 weeks later. Yeah.
Thank you, sorry.
It's okay.
Do you have any tips on how to select a good prebiotic, probiotic, or
A good probiotic? I would just look at, do they follow GMP, good manufacturing practices, and Are they about the same price as other ones in the market? The ones that are way cheaper, and this is a sneaky thing actually that I'm glad you asked this. What some companies will do is they'll say, our 50 billion probiotic, you check, it's 4 capsules to hit that serving size. And there are 20 capsules in the bottle. And you're like, wow, this probiotic's only $17. It's a great deal. It's like, yeah, you have 4 days of, of that dose in that bottle. So I would be wary of that, and also the ones that are way more expensive, they might just be, blowing smoke and charging more than is justifiable.
I have 2 questions. One, if someone does have a fungal overgrowth, there's conflicting information on die-off, avoiding probiotics, healing, and then reintroducing probiotics, but there's also information that says, no, it's fine to do die-off with probiotics. So there's conflicting research on that. I'd like to know your thoughts on that. And my second question is refrigerated probiotics versus gut acidity versus room temperature probiotics, and what you feel about
Right.
that.
With the die-off piece, to my knowledge, there's no really good randomized control trial data that answers that question, so all we can do is sort of clinically speculate. And when we look at the fact that probiotics tend to synergize with antimicrobials, and that probiotics may prevent the need for antimicrobials, and that probiotics are anti-leaky gut, anti-inflammatory, I think it's really unintelligent to put off the probiotics, but rather they should be moved up. And I used to do it differently, right? Because the lab-centric perspective is, well, this person has XYZ on their lab test, so you got to go guns a-blazing with the antimicrobials. And that's starting to shift as we're realizing, well, hey, probiotics are anti-H. pylori, anti-parasite, anti-fungus, anti-SIBO, and they're reparative to the immune system and to the gut. So let's start doing those earlier. But there's still some holdout from sort of that, I think, last generation of thinking, if I may say, with all due respect, because I used to do that too. But I do think doing them earlier is probably better. And another study by Zorzella and colleagues, they actually heated up probiotics and killed them and then gave them to individuals. And they found the same effectiveness as live, intact probiotics. So the refrigeration probably doesn't matter. And the enteric coating I also think is a bad idea, actually, because we want it to activate in the small intestine. This is where most of these problems are occurring. So waiting to get it all the way down to the end of the line, small intestine, 22 feet, 95% of calories and nutrients are absorbed. This is where the party's at. We want the probiotics to have activity there and not wait until you get into the large intestine. Yep. Is that my time? Okay. Thank you, guys. I'll take questions in the hallways, too.